Hi everyone, as Jim has introduced me, my name is Rumbi Mbondiya. I'm very new to research, so I'm not as experienced as Jane. Very fresh on the board. But I'm currently a PhD student at Bradford University. I started my PhD in February this year, so I'm very early on in terms of the research and the study. I've literally just completed the first chapter of my PhD, which was a systematic review. And my PhD is based, as you can see here, what are the key drivers and influences of pursuing career choices within the nursing and pharmacy fields. So the title itself has kind of evolved and changed since commencing my PhD based on my literature review and the information that kind of manifested after I conducted it, and also based on my first progression review, which is the doctoral thesis panel meeting. So from recommendations from that meeting, I have since kind of looked into my topic and probably tweaked it a little bit. So the reason why I've kind of chosen to pursue this piece of research is quite personal to myself. Having worked in clinical practice and kind of still dipping in and out of clinical practice, I have been kind of at the forefront of working in very chaotic working environments with, minimum staffing, and the impact it has on patient care, the impact it has on the well-being of staff has been kind of my passion and influences in terms of pursuing the research. I kind of started to want to ask or pose a lot of questions in terms of how we can look into the issues around staffing and trying to address them. So the purpose of the research itself is to try to address recruitment and retention, and to look into marketing and career advising strategies. Initially, before I just during the process where I was undertaking my literature review, there was quite a lot of work done on retention and recruitment, and based on staffing shortages, a lot of strategies being implemented by the NHS in terms of international recruitment, in terms of looking into how they can retain staff. So I felt that I changed the goalposts of the research, and I'll just continue on as I go on to so as I said, it's to kind of strengthen strategies within which may enhance effective ways of career guidance, marketing strategies, as well as address recruitment and retention within the programs at the university, as opposed to the actual NHS, based on the fact that there was quite a lot of extensive literature already done for the NHS in terms of strategies to recruit and retain staff. So I thought of probably tackling these issues earlier on, or within the university programs, to try and tackle it early on. So my research is by a mixed methods approach, which I will kind of talk about as I go along in the presentation. So the rationale for the research in terms of the literature that's available, there's a lot of research that indicates that health professions are generally motivated by a combination of intrinsic and extrinsic factors. So some people will have, a passion or calling to pursue healthcare, who believe that they have a passion or calling to pursue, it's within their morals and principles to pursue healthcare programs. And extrinsic factors would be around, trying to have a job that kind of addresses a good work-life balance, or jobs that would offer certain incentives, or a stable career or stable salary. So those were kind of some of the rationales for my research, and quite a few there in terms of the work that I found. There was stuff around understanding why participants choose a career in health, maybe critical in determining whether the factors have remained constant or have evolved over time, and it will have a significant impact on developing more effective strategies for addressing current healthcare workforce shortages via the recruitment and retention pipeline, as I discussed. There was stuff there about how institutions could provide additional platforms for students to learn about healthcare careers, such as career fairs, increase in financial compensation, and providing decision-making avenues, all aimed at tackling recruitment and retention of students onto then pursuing their careers. Most recently, again, prior to Charles and Ewbank there did a study that outlined that prior to COVID-19, the greatest challenge faced by the healthcare industry was the workforce crisis. As I said, clinically I have been at the forefront of working within staffing shortages, and the impact it has on staff is, the staff feel quite burnt out. They start to feel, start to want to leave their jobs, and that kind of has a knock-on effect in terms of the patient care that we provide. Presently, the effects on recruitment and retention of healthcare personnel post the pandemic are showing significantly increased risk of severe staffing shortages. So to kind of address the short and long-term labor shortages, concrete steps must be undertaken. And I've chosen to kind of pursue this very early on in terms of how we recruit students within the nursing and pharmacy in specific programs, based on the fact that I myself am a nurse, I'm a mental health nurse, and it's I think there's evidence out there that shows that mental health nursing is very undersubscribed. It is also not very appealing as opposed to other nursing fields. So we do need to look into how we can kind of take students on board, what kind of motivates students to come onto these programs to then be effective practitioners which then kind of has a knock-on effect on the retention in their later careers. And for the pharmacy component, my supervisors, Professor Simon Twedwell, based at Bradford, and Dr. Gemma Quinn, are all Dr. Samantha McLeon. They're all kind of pharmacists by background, so they wanted to kind of try to look into effective recruitment strategies within the pharmacy programs. So it's like a joint venture in terms of nursing and pharmacy. So the recommendations for research are exactly just what I've just been touching upon, which is around, the fact that there is like a global healthcare professional shortages that necessitate effective recruitment and retention strategies. There's also an aspect of recruiting and retaining healthcare professionals in terms of it is quite a significant challenge to do so. And as I said, there's a lot of research, extensive research in terms of how that's being done currently. However, I noticed that during my literature search, there was nothing sort of being, I wouldn't say nothing, but very limited information in terms of the recruiting students onto the programs, onto the nursing and pharmacy programs. Some identified contemporary issues there were to do with, as I said, attrition in healthcare programs is becoming an increasing concern on a global scale. And to reduce attrition amongst healthcare students, strategies must consider the entire student life cycle from recruitment to graduation in order to establish reasonable student expectations and to ensure that a career in healthcare is both desired and valued. And my study would kind of look into trying to interview students at the start of the program and towards the end of the program, and follow them through till the end of the program, just to try to understand, what their motivators and their drivers are and whether they've changed, and also trying to see whether we have kind of there hasn't been any kind of attrition during their that kind of phase. So in terms of the methodology, as I said, it's a mixed method approach, which where I would start off with probably pursuing quantitative research in the form of surveys, which will be sent out electronically to students from a range of universities that I'm affiliated with. Hopefully Sheffield Hallam, Bradford University, where my supervisors are. It's a comparison with the USA, so I have been connected to Drake University and also De Montfort University, where I'm going to work. So I'll start off by trying to quantify the data, and then it will be followed by a qualitative kind of research in the form of phenomenological approach, where I would undertake interviews, direct interviews from participants. So, as it says there, the benefits of a mixed method approach is around capturing quantitative data may be quite beneficial in determining the study's objective. So apart from quantitative research, as I said, I will be using a qualitative phenomenological approach, which would enable the documentation and description of this kind of scant available data. So as of now, I've literally undertaken the first chapter of my study, which is a systematic review. From that, I've been slightly changed the goalposts, and I'm just still trying to work on more literature scoping, a more kind of intensive literature review with my new kind of approach in terms of targeting students as opposed to clinical practice. And that's where I am at the moment. Thank you. Thank you. Thank you.
Yeah, I've got a question, if that's okay. So you said that your literature review would kind of slightly change the focus of your title and question, and I suppose I was just curious to understand more about kind of what you read and how that influenced your question and title.
I think it probably lies on the authenticity of my study. It felt like I'm just doing repeated work, and there's quite a lot at the moment on recruitment and retention, and recommendations of how to tackle that. There's international nurse recruitment program going on at the moment. There's different retention strategies that are being implemented in policies within the NHS itself. So I just felt like it would not be as authentic.
I've got quite a few questions, but thank you for the presentation.
Thank you.
From what I can deduce, you mentioned about going to focus on student nurses and then pharmacy students.
Yes.
But then these people have not been directly in the care industry where they have lived experience will give us more information about burnout and other things.
Yeah.
So how are you going to gather enough in-depth information on that? The other aspect is that the topic is it global or is it focused to any particular care setting?
Yeah.
You mentioned mental health, but the coverage for the research, maybe if you want to look at that one. And then you mentioned about recommendation for the research.
Yeah.
I don't know why the recommendation at this stage for the research after mentioning about rationale. And that's my only concern. Or maybe you can later on look into that.
Yeah.
And then you also
that's a
talk
lot of
about.
questions at once. Let Rumbi answer at least one of them.
I think in terms of the first question, which was in relation to burnout, it was more towards the kind of my experiences of working at the forefront of clinical settings and working in settings where there's a lot of staffing shortages, and it was more around the whole to give a picture of the issues within this of staffing shortages and the fact that the recruitment and retention needs to be tackled. However, in terms of tackling it, I thought to look at it within the students pursuing healthcare degrees, and if we have the right skill set, the right students who may who have the kind of the right qualities to pursue these healthcare degrees, as well as if we might be able to, we are kind of indirectly addressing recruitment and retention in the long term. And your other question, sorry?
I talk about the focus. I talk about the focus, and then I mentioned about the recommendation for the research.
Yeah.
That you talk about. I don't know how ethical typical clearance will be when dealing with nursing students as well as pharmacy students, because they all have their values or their approach to work. And so I don't know how that's going to be handled. And then how are you going to deal with reflexivity in terms of your phenomenology that you're going to apply in your methodology? Along the line, I'll ask more questions.
Okay. In terms of the recommendations for research, they were more around to inform my present research and not towards like my own kind of recommendations.
Right.
Yeah.
Yeah, I was on the same line actually. As what's the synergy between pharmacy and nursing then? And you know, because it's quite a, you know, I can see because it's like two studies, but in that sense. But where's the meeting point of the two? I know from, you know, having had patients who are pharmacists recently, how incredibly stressful their work environment is, and how much pressure, and because of the most of them work in the private sector, don't they? And those demands. But I'm thinking, what's the shared stuff that you're going to you think you're going to get between nurses and pharmacy?
Yeah, I think initially I was looking into the entire healthcare workforce, which I was I was probably advised against by my doctoral thesis panel, and they suggested probably condensing it into one field or two, and the ones that we kind of chose were my own background and my supervisor's backgrounds. But in terms of the synergy, I would have to undertake more kind of literature scoping to see whether there's any kind of connections.
And how are you going to collect your data? What data do you think you're going to collect? Are you going to be doing interviews? Is it like a qualitative side, an ethnographic side, or is it a participant observation, or?
So it would be start off with surveys and then interviewing.
Okay.
Yeah.
Sorry, I can't see hands up.
I'm just following up, on the same thing really around the synergy between pharmacy and nursing. Yeah. I'm actually quite confident that if you do a mixed method study where you've got some quantitative data that look at those two groups of people, and then you look at some, what their experiences are, that's where the synergy will come from. It'll come out of your analysis, I would imagine. That that's part of what you're going to be doing, or have I misunderstood?
Yeah.
I mean, it's early days, isn't it? But I'm thinking, although it feels like it's a little bit of a random selection in one way, just convenient professions that your team represent, but they may represent the wider health workforce in different ways. So I guess that's what you're trying to show, isn't it?
Yeah. Oh.
I totally agree with the. You will find out that later, I'm sure. The questions I have is that.
One at a time, those two.
Yeah, one. And is that mental health nursing student, we are not short of them.
Yeah.
We've got loads of them coming through. Most of our LD nursing will be shorter because we don't have as many people want to be LD nurses. Adult nurses, we've got tons of them anyway.
Yeah.
So how to tease them out, that's quite interesting. Between the branches, I think you might need to consider that. Yeah. Another thing is that you're saying that quantitative research, you're going to do a survey. I totally understand that. What kind of question you're going to ask? Because you've done your progressions now, the next bit is your questions. So what are the questions you're going to pose to year one student about your topic?
Yeah.
How are you going to formulate them?
Yeah.
Can you sort of suggest some question to us?
I haven't actually looked into what kind of questions I'd like to pose or how I'd structure them, but there was a suggestion from my panel to probably involve stakeholders in terms of trying to formulate the ideal questions. So I I don't have any from the top of my head, but
So that's why sometimes is that I think what going back to Jim's question is that sometimes you might have some focus group to formulate your questions and then throw out the survey to test your questions and then come back and then say, oh, are those questions
That's not about shouting.
come back. Because what happens, I see so many people do survey, can't they? They just throw a question out and then don't get your aims and objective. So in some way, I think what Jim's question is quite sensible. Which way you go first, sometimes might be what you said already, and allude to have a student panel and have a stakeholder, and then have an interview for network, and then got those questions into the bag, and then use that to formulate your sample, because your sample will be hundreds or 200s. You don't want to throw 200 questions out and end up with nonsensical answers.
I wrote push where it moves when you were talking about you looked at us at shooting, got that access, and for sure, and at De Montfort and at Bradford, and also in America. And I think that's how you get data, isn't it? By using relationships and using that, and sort of if it's going to move there, so you've got 3 people who are your supervisors who are embedded in pharmacy and leaders in pharmacy, so they'll be able to they'll enable your pharmacy sample in these 4 sites, won't they? So sounds right interesting, and actually the data speak for itself. Last 2 questions.
Have you considered a Q method? If you read about Q method to use it maybe to get information from group of people, maybe if you want to use pharmacy and others, have you considered use of Q method where you can maybe develop something around this group category of staff and then eventually move on, and then as they are suggesting to whether focus or whatever. And then finally your survey method. And look into Q method and see whether it can be applied in this area or not.
Thank you.
That's a good shout,
Thank you
isn't it?
very much.
I wonder whether what might be used. One of the things that I don't know in terms of feedback, but we want this to be a genuinely dialogical experience coming to the NorQual. So if you wanted to offer, to give people some, remind people about, because you probably didn't make a note about that, did you?
Oh, yes.
But it'll be in your head, and then you go, what did he say? Just so we can pop something together, either fuddle it through Karen and I, and we can send it out to the presenters, or just communicate with each other directly. What do you think? Yeah? Did you have that question?
Yeah, I was just curious really, and you might not know yet, so I know it's early days, but I was kind of curious thinking about pharmacists and nurses, and whether if you did have focus groups or whatever, would you kind of in terms of your data, would you say this is the data for nurses, this is the data for pharmacists, or would you kind of interview them together, and if you were doing a focus group, for example, and would you at the end result would you be able to separate the make those distinctions if in case because there will be similarities, I guess, in terms of some of the things that you explore, but I suppose informing further research, would you be able to tell these are the issues for pharmacists, these are the issues for nurses, and I just wondered whether you plan to do that all together or separate them.
I think I was thinking best to keep them separate and probably just look into each field on its own, and then try and draw out similarities from there.
I loved your infographic actually. Hexagons, that works really well. It's a visual representation of how the themes. Nice. Because you might end up with 2, might be one for nursing, one for pharmacy, and then one which is this is the shared one. Interestingly, isn't it?
It's interesting what you said about shared, because when I first started that, it was a bunch of circles and it was ovals, and they were all on lines, and then they kind of all came in on themselves, and then they all landed on top of each other, then they all went back out again. So it's quite, if you set it up in PowerPoint, you can move your circles in as long as you keep your versions, because I think certainly what Stevie said about separate, looking at branches separately, because certainly what we're finding in the north is that a lot of our mental health students, the motivation is cure thyself, and we're getting a lot of students with severe mental health problems that have moved in through services who who are experienced experts by experience and have been through the system and then want to become, because they've either seen a brilliant nurse or they've seen a nurse that they perhaps didn't like. And you know, it would be really interesting to compare that to other fields and see if that's the issue in other fields.
Definitely, yeah. So thank you very
Beautiful.
much for all this
Good.
advice. Thank you.